Now, the state of Kansas is taking a unique approach to monitoring cases in the metro. KCTV5's Leslie Aguilar is at a Johnson County wastewater treatment plant to explain.
Right now, both Johnson and Wyandotte County are taking weekly samples of wastewater from all of their plants. That's because you start shedding the virus in the bathroom almost immediately after contracting it, even before symptoms show up. So the idea is by tracking toilet water, they can detect a surge in COVID-19 cases at least a week before the hospitals start seeing it. COVID-19 cases and hospitalizations in Kansas and Missouri are going up. The state of Kansas is keeping a close eye on Johnson and Wyandotte counties.
The hypothesis is this, that if another big wave of the virus comes rolling into Kansas, it's going to roll in from Metro KC. So we're treating the two counties as kind of our gatekeeper to keep watch for signs of another big spike.
Tom Stiles with the Kansas Department of Health and Environment is overseeing a new study of wastewater. They're doing weekly tests for COVID-19 RNA. That's basically the DNA of the virus. Samples can't tell how many people are shedding the virus into the sewer system, but tracking it week by week would be able to detect a spike.
You can see it in the wastewater probably a week ahead of what you can see in terms of positive cases being reported.
The hope is that a week would give time for hospitals to prepare for an oncoming wave.
The number one objective is for them to be able to stay one step ahead of the influx of patients.
We clearly are concerned as we start to enter into the colder season.
Truman Medical Center's Chief Medical Officer Dr. Mark Steele says people gathering indoors due to the cold and the holidays could be a problem. Add that to the upcoming flu season, and there could be a perfect storm.
Quite frankly, our largest concern, and this is a concern of all the other CMOs that I've spoken with, is to be able to have enough staff to provide the care if we get a big wave of patients.
Dr. Steele isn't aware of wastewater surveillance helping other hospitals prepare, but says any tool is a good thing. Wastewater surveillance has proven effective in other states and countries, not just for COVID-19, but for things like opioid use, polio, and tuberculosis. Reporting in Johnson County, Leslie Aguilar, KCTV5 News.